Okay, so welcome back to another episode of the Python People podcast, the home for global technology leaders to share insights with the tech community. And this week, I'd like to offer a warm welcome to Ben Lakey. So Ben is the co-founder and CEO of Syndi Health, who are an exciting digital health platform that's providing bespoke healthcare solutions for the mental health space. So Ben, thanks for being here with us today. How the devil are you?
Doing well, thanks. Thanks for having me.
Good, not a problem at all. My pleasure. My pleasure. Yeah, I guess without further ado, Ben, I think it's fair to say you've had from our first meeting, I think you've had a really interesting story so far as an entrepreneur and leader of different sort of tech related businesses. So we thought it'd be real value there to share a bit about your journey, your kind of learnings as an entrepreneur, but also hear a bit more about your great work that you're doing with Syndi Health as a business as well. So I guess as a starter for 10, if you could maybe give us a bit of an overview of your background and your your career bio to date, that would be great.
Absolutely. Um, can't say I grew up thinking I wanted to be an entrepreneur and a founder, and one of those people that really fell into it. Went through a lot of things growing up, and a lot of things within my career after university that's kind of led me into this awesome opportunity. I grew up in Canada, in Alberta, really interested in building things and how things worked, and thought mechanical engineering was the kind of best place to get into that. So studied mechanical engineering at the University of Alberta, did the co-op degree, which meant 4 years of academic work and also 18-month work terms. I did 3 of those in Alberta and 2 of those in Berlin and California. And those ones in Berlin and California were very centered around actually making things that help people, biomedical engineering. I graduated in 2015, and at that time, the market in Alberta was quite a roller coaster. The industry revolved around oil and gas, where I was from, and I really fell into that. So worked in large scale project management for 2 years in the Canadian oil sands, fly in, fly out, week on, week off. Not the best place for your mental health by any means, but it got me into a really exciting role, high stress and high responsibility role, managing people, managing projects, managing schedules. But I was always interested in going back to that thing that I had a brief experience with, is actually making things that help people. And the oil and gas industry wasn't exactly that place. Everyone else in my family is a PhD clinician or a nurse, helping people all the time. So it wasn't too exciting and rewarding, really going back at Christmas and talking about what I was doing in the industry. So to get out of that industry and into the biomedical space, I came over to London in 2017 to study medical device design and entrepreneurship at Imperial College. Very niche course, all about going through the clinical trial processes, regulatory approvals, IP protection, go to market, and really fundraising for medical device companies. I was researching myoelectric prosthetic control, so the control systems for robotic hands. This was really, really exciting in the laboratories. My sister's an amputee, which I was interested in that space, but they weren't too useful in the real world. It was like putting new rims on a Ferrari, upgrading these 50,000-pound prosthetics that 4 to 5 people in the UK can get each year with another degree of freedom. It wasn't that impactful, but it really opened my eyes up to the space of, again, building and manufacturing and selling products that can help people. So off the back end of that master's, I met another student at Imperial College who was researching these low-cost prosthetics. So direct consumer, medically approved, really was the vision. We founded a company called Mitt Wearables, which ended up being just that, the first FDA-approved and CE-marked prosthetic hand that could be sold and fit direct to consumers. So that was a really awesome first few years of my entrepreneurial career, and again, really kind of fell into it. I loved the space, one with my sister's background and the research that I was doing at Imperial, and it was a roller coaster. More good days than bad, but really taught me a lot about that founding experience, hiring people, raising investment, building a company and a product that again could really make an impact in people's lives. But that industry, it was quite tough. The market is quite small in the UK. Manufacturing is really difficult in supply chains, and especially heading into 2020 when all those got disrupted. Started thinking about what to do next. And as I was going through that up and down process and building the company and managing those relationships, one of my mentors, who I met through Imperial College, said, "Oh, you should talk to someone. Go to your clinician, ask for help." And at that time, I thought, I don't need that. I'm a man. I'm big. I'm tough. Finally went to my GP, and that was the big step for me. Where okay, I've done it. I've asked for help. Things are going to be all good here. But I was placed on a 10-month waiting list. And in that 10 months, there was no monitoring, no support, no digital health options offered to me. It was just a black hole. So that really opened my eyes up to the space that I'm in now. These wait lists and this digital health revolution, all these services that I was hearing about in that time of need, in that pathway, they're nowhere to be found. So that's when I made the decision, okay, first time founder, company, was doing well, but it didn't seem like the best fit for me. Learned a lot about the co-founder relationship, the importance of that. And I thought, yeah, it's time for me to take all those learnings and try something new. But this was in 2020. There wasn't too much in-person networking to find another technical co-founder. So I joined Entrepreneur First, which is like a co-founder speed dating type accelerator here in London. And I met a awesome co-founder there who's a developer, a data scientist, got a master's in AI. He can do all the things that I can't do. We really complement each other really well. And he had a similar experience to myself, going through the counseling services in university, waiting 4 months for counseling, having 4 sessions with 4 different people, and then being told to go back to his GP, being prescribed antidepressants, and just kind of told to get on with it. So we got together, thinking about our experiences and our backgrounds, and thought, how can we build an impactful company in this space? Software we saw as the future, this digital health revolution that had potential, but there was a missing piece. And that missing piece that we found from talking to more people like us and clinicians and the actual digital health service companies, was that a way to actually find, utilize, and pay for these digital health services, figuring out which ones are right for which people at which stage in their journey in the real world. So Jorge and I got together and we founded Syndi Health in October of 2020. And yeah, 2 years in now, no shortage of learnings again. And second time is a lot easier in many ways as a founder, but very different industry, very different products. So continuing to learn and continuing to grow.
Cool. Awesome. Well, thanks so much for that. That is amazing story. And what I really like about, I guess, your entrepreneurial view is it feels like both the businesses that you've kind of been a part of so far that you started have been drawn from really personal experiences. Obviously with your developing a wearables business, sister being an amputee, and then having gone through your own personal situation with regards to mental health and sort of addressing a business problem there. How important is it for you as an entrepreneur that you are I guess personally attached to your business and emotionally involved, and do you feel like it's really important that you feel like you're helping people in your business, or how important is that to you, I guess, as an entrepreneur?
Very important. I think it doesn't have to be one or the other either. You can build an impactful business that can also be a lucrative and really high growth business, both for investors and yourself as a founder. But I think that aspect of having the personal connection or that passion to make that change, I think it opens up a lot of doors. It's a lot easier to hire people to really share that maybe emotional connection with you, whether it's them having an experience themselves or a family member. I think mental health, it touches so many lives that it makes it quite easy to find people who really care about it. And helpful to raise investments, again, with investors that have that connection or passion to make an impact, as well as sell the product. If you care about it, if you truly believe in it, it can go a long way. And I think, building a company that I wasn't personally attached to or didn't really have that passion to make the change and get it out there, I don't think I'd be as invested, and the long days would be a lot tougher to get through.
Yeah.
Really, I want to build a company and a product that it doesn't feel like work. You love it so much and you see the impact so often that you can get through the grind of a startup a lot easier with that in the back of your mind, instead of doing something you don't really want to do for an industry that you don't really care that much about.
Yeah, absolutely. Yeah, I love that, because that actually really resonates with me personally, and why I started true north, I guess, because I think we spoke about it before. My background was spent 10 years at another company, and when I left that company, I was really quite disenamored with recruitment as an industry. I thought it was all about making money for the sake of making money, and there was no real focus on fulfillment or growth or development, or actually just enjoying your life with what you're making the money for. And I really wanted to get away from that, and I left that job and ended up interviewing lots of other companies, offered lots of other roles, but actually with a lot of them it felt like I was really just jumping out of the frying pan into the fire, and kind of replicating the same kind of issue. And so I took 4 months out myself just to think, actually, do I want to stay in recruitment? Do I really want to do this? Because the one thing I personally felt was off the back of my my 10 years in my previous company is my own personal health had taken a real knockback as well. And I wanted to build a business that actually I could feel like sustainably be a part of for the next 10 years moving forward. And I realized actually I did enjoy recruitment. That time out to sort of reflect, I did enjoy lots of parts of the job, but I just really wanted to fundamentally change the angle on, I wanted to be more about people, and less about the money. And I believe that you can have a really lucrative business. This is more of a sustainable business that if you just focus on actually, and it sounds cheesy, but genuinely our mission, what I want the business to stand for, is to help people be happy at work, because I know firsthand how much work can have a real detrimental impact on mental health. So I totally agree with you. I think to actually really believe in your business, you've got to be emotionally engaged in it and bought into the mission. And the helping people element of things, to me, really rings true. Why, out of interest, I guess you've obviously touched on it a little bit with your own personal journey, but why did you choose to start with kind of mental health services, I guess, versus, you could be helping other people in lots of other areas of healthcare. So what was sort of most poignant to you about tackling the mental health situation?
Yeah, mental health is very much the starting point for Syndi. And we started there because of our personal experiences. We were frustrated going through this problem ourselves. From the founder by experience, we thought that's the best place to start. And also the market is the most flooded and overwhelmed in mental health. There's over 30,000 well-being apps, telemedicine services, digital therapeutics now in the market. And it's the worst of the worst of the chaos out there. MSK, diabetes, chronic conditions, men's, women, specific health, they're starting to be more flooded in that capacity. But the customers that we have, whether it's direct corporates, the insurers, the employee assistance programs, their kind of budget and focus has been on mental health as well. We thought that's a good place to start and then branch out from there. So kind of going up the value chain in terms of customers and segments, but also expanding then into other clinical areas. So the plan is to continue to focus on mental health for the immediate future, but build those foundations for expansion out. And with mental health, it's not a singular kind of isolated area. If you're waiting 12 months for physio, your mental health is going to decline as well. If you're going through a very difficult chronic condition, your mental health is going to decline as well. So really the aspect of comorbidities is something that really excites us, and linking all these pieces together into one platform, one service that can support your health in a holistic way.
Yeah, I think that's great, and I totally agree with you. And I think that there's obviously lots of different contributing factors that will impact, either negatively or positively on someone's mental health. But I think that it feels particularly poignant, what Syndi Health is doing in the world we live in now, right? Because I guess we've all gone through a couple of pretty terrible years with the pandemic, and then obviously the horrific war in Ukraine, and then all of the political uncertainty and the recession that's on the horizon, all that kind of stuff. And it just feels like we're living in a time where there's a lot of stuff out there that kind of on a global level that can really have an impact on someone's mental health. And it's great to hear that companies are actually taking note of that and actually really looking to find a way to monitor it and kind of build on that. And how do you feel, kind of having been through your own personal journey? I think there have been big strides forward in kind of raising awareness around mental health generally and tackling it as an issue and sort of removing that stigma, I guess, as it being a bit of a taboo subject. But how do you feel society is kind of viewed in how do they view mental health today?
Mm-hmm. It's changing for the best. I think, to take the UK compared to where I grew up in Canada, it is quite different. I think North America in general, it's a bit more open. People talk about it like going to the gym. I'll see my therapist once a week, and it's not as stigmatized. I think, yeah, the landscape here, it is changing, definitely for the best. I think COVID is terrible for a lot of reasons, but positively impactful in one, showing people that you can get care virtually and you can trust these things. But two, people started talking about their mental health a lot more when everyone was going through the very similar, difficult isolation at the same time. It became more of a conversation to have. So I think the last few years, it's really changed, and it continues to change, but there's still a lot of work to do around that mindset of it's more like fitness. It's mental fitness, and you don't need to get health care when you really need it. But if you be more preventative, you could capture these things earlier and prevent them from becoming bigger issues. And with the state of the backlogs in the public health services, I think that's the mindset that has to be had, that if we're, mental health kind of crisis service, whether health care, things need to change, get people help sooner, the most effective services at the first time. But to do that, people need to be open to talking about it, open to accessing things. And I think that starts with the people at the top, whether it's the employers or the kind of insurers. If you talk about this in a way that is more open and acceptable, people will be more likely to access things before they really, really need it, and the costs go way up.
Yeah.
So lots of work to be done still, but it's heading in the right direction for sure.
Yeah, absolutely. And I guess it's people knowing that there are things they can access as well, right? And knowing that the solutions out there. Because I mean, I personally class myself as somebody that I think is relatively aware of kind of my own mental health, having been through what I feel like I've been through in the last few years. But there are still times where, I feel like it's just better to bottle stuff up and not talk about it. And, I won't sort of proactively go out my way to find a solution, maybe to solve that problem. But I do feel that, that I think your point that you made around COVID obviously being really positive from changing that paradigm around people being able to digitally access healthcare, I think is really important, because I say there's a lot of bad stuff that's come off the back of COVID, but actually a lot of really quite positive transformational stuff around, people being able to work remotely, interact remotely and access services remotely as well. So I think that's a really good point. And, people are aware that solutions like Syndi Health do exist. Then obviously people can be, maybe a little bit more empowered to do something about it, and not feel like they've got to go and see somebody maybe. And, it sort of feels maybe a little bit more accessible, that can be done from your own home.
Exactly.
So I guess with that in mind, where do you kind of feel the digital health industry is headed, and what do you feel are kind of some of the biggest trends that you're seeing out there?
Yeah, so a few different things. There's the level of services. So there's the well-being apps that really started B2C and are moving more B2B, but also getting more clinical, and the more digital therapeutics, the prescription digital services coming out there. But overall in this market, it's been so overwhelmed that it's not sustainable. Whether it's companies that just can't prove their business model and can't get funding, maybe they'll fall away, or there'll be acquisitions from the biggers to try and consolidate it down. But something has to change, because whether it's the end users being patients or employees or members, they don't know where to look and what's right for them. The actual organizations that are trying to pay for these licensees and offer these, again, they don't know what to pick. And then into the more clinical pathways, again, they don't know what to reimburse. And the digital health services, they don't know who to target. Who is their service best suited for? So there needs to be really this consolidation back to something that's just understandable. So we've seen a lot of obviously acquisitions in the space, and more people like us coming up who are more the aggregator, the infrastructure between the organizations, their people, and the digital health services. I think the really exciting thing for us is the way these, I guess, mental health services being measured, but also just mental health data, the real world impact starting to take into account. Okay, in a trial, it worked like this for these people, but in the real world, this is actually how it's utilized, and this is actually how it's benefiting people. And changing that aspect, or change that viewpoint of getting approval and now it's good to go, and now it can be given to anyone, into okay, they've had a trial for this, but that was with adults. Now it's being given to kids. Is it actually proven for them? And if they're at this level of severity, or they have this kind of comorbidity or background, is this actually the most impactful thing for them? So a lot niche or kind of targeting down, where even therapeutic services, it can be, say, religion-based, language-based, sexuality-based services, different clinical grades. So the more well-being, the more fitness of your mind, and then more into the, say, mild to moderate services, then into the crisis services, the severe disorders. There isn't a one-size-fits-all for everything. And I think that's why the market has been crowded as well. People are trying to throw things at every single point, but there's going to be consolidation down. And what we want to help with is really put those buckets together of what services for what people, with what background, for what areas. So it's finally the point, where there's enough things on the market, enough good things on the market, but we need to bring it back down to something that's understandable. And the whole measurement piece, a lot of research is going into using other data points to measure mental health, whether that's passive data from smartphones like GPS, accelerometer, even Bluetooth, Wi-Fi connections. Are you leaving your house or not? Are you walking or not? There's lots to be done around that space. I think it's a few years away still, but instead of just doing these active self-reported measurements and surveys, utilizing more information that we have to better judge effectiveness, but also to better recognize that those people are in need, or they need something and need to change their behavior, or need to be offered something else. And linking that all into one platform is what really excites us. That kind of real-time recommendation of what is best for your health based on previous similar people's data is really where we want to get to.
Yeah, absolutely. Yeah, it must be really fulfilling knowing that, like I say, it's a lot of work. I can imagine there's going to be so many different factors and variables to take into play there, but it must be quite exciting to also think that actually, based off like smartphone data and things like that, there is actually a lot of really positive sort of predictive work that can be done. It doesn't feel like it's too far away in terms of actually being able to get the right data and access the right data to really give a pretty good read on some of the things that could actually have quite a big impact on somebody's mental health. Like say, even just as far as like, is somebody like getting out and doing 20 minutes of exercise every day, either walking every day? Because if they're not, that in itself, people just don't realize has a huge impact on, your kind of natural endorphins, doesn't it? And things like that. So, that's really cool. So what would you say then has been your kind of biggest challenges that you've faced as a startup in this space so far? I'm sure there's been many, but in terms of the the sort of the bigger ones, what would you say they've been?
Yeah, no shortage of challenges. I think if there weren't challenges, then we wouldn't be pushing ourselves and pushing our team and ourselves as founders as hard as we can. And definitely the biggest challenge I've seen in both my founding experiences is people, whether it's internally and the people you work with, and figuring out what motivates them and how do you keep them aligned when things can change so rapidly. In a startup, it's really difficult to keep everyone heading towards that same North Star, but keep everyone motivated in the way that they need to be motivated, whether that is impact or as employees, is it financial? And if it's customers, what motivates them to buy, what motivates partners to work with you. And in mental health, there's so many different aspects to it and so many different experiences people had. People are so diverse and mental health is so broad that figuring out those things, really what motivates people, how do you get people aligned on that same mission? And if that mission changes a bit, is that still something they're interested in? Is that still the vision that we have for the company? So continuing to change the product rapidly, but stay true to that mission, I think is really, really interesting, and have the right people around us and with us. And not everyone's made for startups either. It's a very high stress environment and pretty unstable. I love it because every day is different, every day is exciting, but some people might not be suitable for them, and that's okay. So it's trying to figure out who one really has that shared mission with us, if they want to work with us, if they want to buy from us. But really, how do you get that across and get the right people around you when things can change so fast? And taking those learnings and those challenges, accepting them, looking at them, but then having that kind of memory of a goldfish where you forget about it and you move on, I think is really important. And you can't dwell on the difficult things. And every day is an up, and some days are down the next. But as long as there's more good days than bad, I think we can all keep moving together. So really the continued thing is that people, and we've been really lucky to have a great group of people around us, but keeping them motivated, not burning ourselves out. We're a mental health company, and me and my founder, we know we work too much, and we try to find that balance with our families and our partners and fitness. But end of the day, we're still founders. So it's finding that balance of motivating ourselves, keeping ourselves healthy, and keeping the team motivated.
Yeah, totally. I massively relate to that as well, just personally in terms of that sort of balance piece, because again, similarly, a large portion of my motivation to start the business was to actually get a better balance, work-life balance from what I had, and was it maybe not a work-life balance, but maybe just actually being able to see my family and like my daughters. So I was kind of doing the classic, 5 days a week up in town, 12, 13 hours a day, and just missing out on chunks of my daughter's life. And so, that's one thing I'm really pleased that I've been able to address with kind of starting my business. But I really like the point you made there about in a startup, and I totally agree with this as well. In a startup company, things change so rapidly that, you can go in this direction in 6 months' time. Actually, you're a totally different business. But knowing that sort of North Star, getting everybody pulling towards the North Star, I think that's so key, isn't it? To sort of have that sort of permeate throughout everything that you do in the business, that there's actually a central purpose or a central sort of driving mission behind everything you're doing, because the means and the ways that you go about doing it in a business can change very, very rapidly. But actually just, making sure everybody still knows what that mission is still bought into it, still engaged in it, totally. And I also agree with you that, not everybody is cut out for a startup business. At the end of the day, you can't afford, unfortunately, to sort of carry the wrong people for too long, because you don't have that, that luxury really, where a lot of maybe bigger businesses do. So you kind of have to put a bit more emphasis on the individual to actually be part of the solution as well, isn't it? If they're really bought into it, sort of be part of that. So yeah, some great points. So I guess you've been a kind of a serial entrepreneur now. I think multiple ventures classifies anyone as a serial. So that's good to say. So what do you feel have been your greatest challenges, greatest key learns, I suppose, along the way? What's kind of the key thing you think you've learned on your entrepreneurial journey?
A few different things. I think on one side, keeping it simple, just trying not to force really innovative tech into the wrong places. And I've seen a lot of companies where it's, say, PhDs, research, and then let's start a company around that and have the tech to solve a problem. Whereas we really look at it as the customers and the users, we're building for them, and they should tell us what to make. And we hold those, kind of ideas very loosely, where it can change so quickly. And I think if you're trying to force something into a tech solution into a problem, it's not going to go well, because you don't have enough information when you start. And the way we look at it is keep it very simple to start, get enough feedback that you can keep iterating. But if you try to pull in way too much tech at the start, you'll just overwhelm everyone and confuse everyone. And our platform is quite complicated. There's various stakeholders and lots of things that we can do and ways we can innovate out and out. But if you go too heavy at the start, you'll lose the people that you're trying to engage with very quickly. You might confuse your own team. And obviously when you speak to investors and come at them with AI this and all that, and we're using passive digital phenotyping data, it can be quite complicated. So we really try and simplify what we're doing and how we're talking about it, and really be flexible in how we do that. Again, not something we researched for 4 years and said, this is going to be a company to solve this problem. We had the problem. We thought, let's build a solution. Similar to my previous company, we knew prosthetics were outdated and expensive and uncomfortable and tough to access. So we started talking to as many people as we could and really figure out what they wanted. They wanted comfort. They wanted accessibility. They wanted to get it in 2 days instead of waiting for 2 months. Even if it was free, they're willing to pay out of pocket to get something quicker that's more suitable for them. And if you go in with that closed mindset of this is the solution for this problem, I don't think you can do that. And again, we can paint the bigger vision of what we want to add in and when to solve these next kind of challenges, but really taking it in bite-sized chunks. This is what we're doing now with this product for these people. and then innovating from there. And once you're in the pathways, once you're in the kind of customer channels, it's a lot easier to add features and expand when you're getting more feedback. But if you go in too hard at the start, I think you're just setting yourself up to really hit some barriers.
Yeah, totally. I think your point about keeping it simple, I think at the beginning is absolutely key, because I mean, obviously everyone knows that tech is the way a lot of software is built, and obviously how it's going to change, or solve lots of problems. But like you say, keeping investors and stakeholders engaged, and like say the rest of the team engaged, and it can't be too far into that every day, all day, sort of lose sight on the problem that you're solving in the first place. Yeah, totally agree with that. And also, like I say, understanding the problem from the customer's point of view, I think is absolutely key. And where, in my opinion, a lot of startup companies definitely fall foul is they kind of, we're building this and this is what we do, without the kind of pivoting mindset of, well, actually, if this isn't kind of solving the problem, then we need to pivot into something else, which obviously is always painful and no one likes change. But I guess that's probably the biggest learning curve that I've certainly had, and I think a lot of entrepreneurs have, is you've got to get comfortable with change, right? Because it's just, you never know what's going to happen, what's around the corner. So you've got to be prepared to pivot when needs to pivot. Yeah, perfect. Okay, great. Well, I think it's been a fantastic episode, and really enjoyed speaking to you and hearing your story, and just really impressed with the work you're doing at Syndi Health. And I think you're onto a really big thing, and wish you all the very best success for the future. And
thank you very much.
I always like to end my my podcast just by an idea I nicked off Richard Reed, who's the guy who started the Innocent Smoothies brand, and he went around and asked a load of famous people kind of their one kind of favorite piece of advice. So I guess I'll do the same with you, if that's okay. So yeah, what's your kind of either your favorite piece of advice for your fellow person, or the best piece of advice you've ever received?
It didn't feel like the best at the time when I was working in the oil sands and doing a job I didn't like and had bigger aspirations in different places. But they always used to say, measure twice, cut once. And I've come across this so many times in the past 5 years where you're not actually cutting anything, but you think of that and you're just not cutting corners. You're doing things the right way, whether that's quality or just professionalism or just respect. And the way we look at it at Syndi, it's kind of with QA, with quality assurance and bugs, and this product that we have, it can impact people's lives. And if it doesn't go right, it could hurt them. So you have to be extra careful and take your time and just measure twice, think twice, cut once, deploy once, send that email once. So it's really that, having that level of kind of passion, but just awareness and care. If you don't care about something, you can cut corners, you can hurt people, you can do bad things, you can, really destroy your reputation as a founder, as a company, as a product manufacturer. And I think in a startup, things can move so fast. And you think, I can't check this twice, or I can't measure twice. I got to get this done. But there's some things that you have to take that time. You have to think about it. You have to care enough about it and think of the impacts of, if I cut this wrong, if I do this thing wrong, what does it mean? So something I've been saying for a few years and trying to instill into the team here, that, not always about measuring, but just have that passion, have that level of care of what you're deploying, what you're putting out there, who you're talking to and how you're speaking to them. That I think it takes years to build a reputation, not to build a product, and then seconds to break that trust. So taking the time, measure twice, cut once. That was a good one from many years ago. I didn't see the impact in the wider world at the time, but I thought about it a lot.
Yeah, I think that's a cracker. I like that one. I think it's so transferable, isn't it, into so many different ways, so physically and metaphorically. So I think that's a really, really good one. And I guess it's that, especially like say in the health tech space, any action you can have a real tangible either benefit or detriment to your end customer, which is something in the health tech space. It's obviously very, very important. But it's like we said, that balancing act, isn't it, between being thorough but also being able to pivot in the right way and move quickly and adapt. And it's finding that sort of sweet spot in the middle of being able to make sure you're doing both those things, which of course is not easy. Otherwise everybody would be doing it. But no, I think that's really really good bit of advice. So perfect. Okay, well, all that remains then is for me to say thanks very much for taking the time to have a chat with us today. And yeah, really enjoyed speaking with you, and wish you all the very best with the ongoing success of Syndi. And I'm sure you'll go on to achieve even bigger and better things.
Thank you very much. Thanks for having me.
Cheers. Take care. Bye for now.